good evening. I'll be your waiter this evening. Here's the menu. Can I start you guys off with any drinks?
Is there any wines that you would recommend?
We have a great selection of whites. In particular, this Chardonnay is really good.
Perfect, we'll take that.
Okay. Here we are. Would you like the whole bottle?
Yes, please.
Okay, great. I'm just going to need to see your form of...
ID?
No, birth control.
I'm sorry?
I'm going to need to make sure you're on birth control.
Well, I'm not on birth control.
Well, then I don't feel comfortable serving you alcohol.
Why?
Well, the CDC recommendation says that any alcohol used by a woman who might be pregnant is dangerous. And if you're not on birth control, you could feasibly be pregnant.
That makes no sense.
Well, for any woman, alcohol use carries a lot of risks. Injuries and violence, heart disease, cancer, sexually transmitted diseases, fertility problems, and unintended pregnancy. And since you're pregnant, alcohol use carries these risks: miscarriage, stillbirth, prematurity, fetal alcohol spectrum disorders, and sudden infant death syndrome.
Oh my god.
We probably shouldn't even serve this.
Okay, well, my doctor tells me that I'm allowed to have a certain amount of alcohol when I'm pregnant.
That's ridiculous. The CDC recommendation says any alcohol used by women who are pregnant or might be pregnant is dangerous.
Okay, well, in that case, I'm gonna have to call my doctor because he disagrees.
Okay, Caitlin, calm down. It's okay. I'm gonna talk to a colleague and I'll get back to you. Okay? Talk to you later. Bye-bye. One of my patients is calling me asking if it's okay for her to drink during pregnancy. What do you think?
I always recommend for my patients to not drink at all during pregnancy. Some studies have shown miscarriage, stillbirth, sudden infant death, cognitive impairment, and physical deformities in babies where the mother was drinking alcohol during pregnancy.
But there are also studies that show no increased risk for neurological or behavioral disorders in children after their moms drank moderately during pregnancy.
Well, I always recommend absolutely no alcohol intake. It's better to be on the safer side. Also, the CDC recommends any woman should be aware of the risks that come with drinking alcohol.
But the CDC says that any woman will be susceptible to injuries, violence, heart disease, cancer, STDs. But this could be susceptible for any person, not just women, not just pregnant women.
Well, I stand by the CDC recommendations.
Well, I just don't feel comfortable advising my patients based on these condescending CDC recommendations. So, but thank you for your input.
Yeah, anytime.
Hi, Caitlin, it's Dr. Fraser. Just getting back to you about your question. I think it's okay to have one or two drinks, but my colleague did point out that drinking could be linked to some adverse health outcomes. Ultimately, the research is inconclusive, but it is your choice whether or not you'd like to drink. However, we both do recommend that you stay away from binge drinking because it is definitively linked to birth defects in children. Okay, let me know if you have any other questions. Thank you, bye-bye.
Well, it seems like there's arguments for and against women drinking. I mean, it's really your own choice.
Yeah, I mean, since my doctor recommended that in moderation it's okay, I think I'm gonna go ahead and have a glass.
Okay,
After considering the risks, I think I'll just take a water.
good choice.
But thank you.
I think I'll have the wine as well.
And that's fine. Every woman should do her own research, make her own choice. It's your body.